Welcome back to Isaac's Dentistry. Thanks for joining us. We've covered several different subjects, and what we're going to do is, last time we talked about dental myths and trying to debunk some of those, but today we're going to skip back to when we're talking about the personal hygiene at home and some of the detriments to not following a good hygiene regimen at home between your hygiene visits here in the office or between your dental visits. So we've got Dr. Isaacs with us again today, and let's start with the basic one that everybody out there has probably heard of, and that's gingivitis.
Right. Well, gingivitis is a term that we use. It strictly means inflammation of the gums,
right,
of the pink tissue. When you look in there and your tissues are pink, pink is healthy. When a dentist looks in there, and we see this daily, almost every patient has to some degree some type of gingivitis. We see some patients every 6 months, and the ones that we see every 6 months, it's kind of rare that we do, but we can generally pick out some type of inflammation. So everybody has it. So if you go to the dentist or come in here or go see a dentist locally, you're probably going to have a little bit of gingivitis. I was activated with the Army back in 2004, and I was so disgruntled because a buddy of mine was doing my oral exam so I could get approved, and I got a class 2. I don't even know why I got a class 2. I'm sure he saw something in there, but I asked him. It was Richard Hughes from Lebanon, but he's a dentist in Lebanon, and I said, Richard, what are you class 2? He goes, yeah, I don't know. You've had a little. I said, I understand. So everybody has it to some degree, but what gingivitis doesn't concern us. What really concerns us is after gingivitis progresses into periodontitis is what we want to talk about today.
Right. Now, and so someone at home's brushing their teeth and it's always bleeding. Is that a sign of the gingivitis, or is that a sign that we've gone to periodontitis, or is it a combination of both?
It could be all three, but it probably is just gingivitis.
Okay.
Because the inflammation of the gums. The attachment, the gums, not to get too technical, but the gums have an attachment to the bone via reedy pegs, and it's the only place in the body these are formed. And once they get inflamed, they break. And once those little attachments, they're almost like little ligaments. Once those little ligaments break, in the sulcus will get bigger and it'll bleed. And that's what you're seeing there. Microscopically, that's what's happening. It's bleeding up through the sulcus, through the natural. There's supposed to be about 2 millimeters of sulcus. I think we were talking about this yesterday,
yeah.
And you want 2 millimeters. Anything more than 2 millimeters is disease, and most people do have a little bit of that.
All right, so gingivitis is kind of that first step of the swelling of the gums and inflammation that, again, we see almost everybody with, but it's to what degree, and if we're not following that good hygiene regimen at home and coming and getting our cleanings here in the office and regular checkups, we then, like you said earlier, we progress to that periodontitis.
What? Yes, periodontitis. The archaic term is pyorrhea, and we still hear that term every now and then. Heck, I even use it just because if somebody says it, I understand. That it makes sense. But for some reason we call it pyorrhea of the gums, but. We never use that term since I've been studying this, but we call it periodontitis. It's a little more descriptive. Perio means inflammation, and then perio means around, and then the dontix is the tooth, and the itis is inflammation around the tooth. Now, when we say around the tooth, we're talking about bone. So periodontitis is a bone infection, not a tissue, not a gum pink tissue infection. It is a hard tissue infection.
Right. So, in short, periodontitis would be an actual bone issue around the tooth.
Once we see bone loss, that is, by definition, that is periodontitis. Okay. And that's a little tougher to treat. And there are so many varying degrees of periodontitis. You can literally have that for years and not know it, and it'll just start. We use the term "eat the bone away." It doesn't really happen. We told you that there's an interface between the bone eating cells and the bone growing cells, and once the osteoclasts win that war, then then you start losing bone, and that's where we see it. And that's our concern. Can we stop that? Yes, we can stop it. Usually with a deep scale, we can numb the tissues, the soft tissue, the pink tissue, and the bone. We can numb that, and the hygienist can go around and clean that out. And it's amazing how well people do respond to that. You can have somebody with moderate, we call it like a type 2 mobility, and after this treatment, it will tighten back up. Your teeth will tighten back up. So it's pretty
Now, I know there's people out there saying, okay, well, we can treat the periodontitis. We can get that scaling done and treat it. Will the bone eventually start to rebuild?
It will not rebuild per se, but it will stop and reattach.
Okay.
So the amount of bone that you lost is probably gone. Now there are some techniques. We can send you to a periodontist, which is it's a specialist that all they do is treat gum disease and the surrounding structures, and they can actually grow new bone, and we can use artificial bone. So if we can't do it here, certainly, well, we send somebody, all the time, daily, almost to a specialist that we can't treat, that we will treat. And can they grow bone? Yes, they can. We don't do it here, and you can't do it on your own, but the specialist can, and that's something I'm going to say in the last 30 years they've been working on that, and it's something we've seen good results from.
Now, the bone loss and the periodontitis itself is a concern, but what I think some people out there aren't aware of is periodontitis can actually have a systemic effect on your entire body. And I know, locally we're talking about halitosis or bad breath and things, loss of teeth, but systemically in the entire body, I know one of the big ones on that list is cardiac issues.
Oh yes, and it's underlying. A lot of people won't even know they have it. In the last 10 years or so, the literature's come out, and a lot of people are getting word that my heart problem may be contributing to my gum disease, might be contributing to my heart problem, and it is. And as far as I've seen in the literature, we're not sure why. We just know that there's a connection. So I'm almost sure it's bacterial. Once you get rid of the bacteria in the mouth, then the bacteria that is going through your body is lessened too. So your body can go ahead and start fighting other things. I say this all the time. It's like having a war. If you've got oral infections, your body is fighting that constantly. You may not notice it, but there's pus coming up through the sulcus. You may either be spitting it out or swallowing it, but it's there. That's where you get the smell. You get the putrid smell of some people. You can smell it when they you talk to them. But that would be the putrid smell that you get. Not to get too graphic, but we've all witnessed that. That can be treated and do that all the time.
Right. So, we've got the initial problem of the periodontitis, the bone loss. That is going to affect cardiac health. What are some of the other systemic health issues that can arise or be connected to the lack of care on the periodontitis?
Since it is bacterial and it goes through your body, it can affect many diseases or many organs. Primarily, it is the heart that we're seeing. The liver is such a good cleanser that it affects the liver. The kidneys, they're going to work a little extra too. We see it. And if you're compromised, if your health is already compromised and you've got gum disease, that's a double whammy. If you've got diabetes, we have a lot of people in this state that have diabetes. So we have seen a lot of gum disease that it's not contributing to the diabetes, but the diabetes is making the gum disease a little harder to treat. Right. So what do we got to do? We got to see it. We got to get in there and either scale it out or remove the teeth that we can't do it. I mean, just the reason why we're late this morning, I was just talking to somebody about this very same thing. Right. He's medically compromised. He's been treated for cancer. His immune system's down, and he really can't have any teeth taken out because of osteoradionecrosis. If you've been treated with radiation, you can't have teeth taken out. So you have to kind of tiptoe around that. So there's all kinds of things we kind of worry about.
And I was going to say, other than kidneys and liver and diabetes being one of those that makes it harder to treat because of the healing process, I was reading something this morning that cancer is another one. It makes it harder to treat because of the radiation treatments and the effects on the bones of the body. So
it's primarily our immune system. Once it gets hammered, then that's going to happen. That's going to stop too. And that's why the physicians, the doctors, are doing a great job of having their patients go see the dentist too. It used to be nobody really cared about it, but now if certainly if you're going to have a transplant, if you're going to have a kidney
Right.
transplant, we're always checking somebody before they can get on the transplant list. A dentist has to okay them.
Right.
So we see that at least once a month now. We have to sign off on something like that.
Yeah, and I've got recent history in my family, the same thing, and I got a phone call wondering why do I have to go see my dentist before
it
they...
doesn't make sense. What's wrong with that? Yeah, but it's because it's all connected, and that's what we're seeing, and we don't think of it, but it is, and that's what it is. That's why if you're sick, if your overall health is poor, probably you got some kind of oral manifestation going on too. It just happened.
So just to kind of recap, the steps would be we get gingivitis, that inflammation of the gums, and the body tries telling us, you're bleeding when you're brushing or bleeding when you occasionally floss. And then left untreated or uncared for in the proper way, that will progress into periodontitis, and that's when we start to see that bone loss and the complicating issues of loose teeth or losing teeth and the systemic health risks as well.
As dentists, we treat these as two different diseases, but they're really not.
Right.
It's one that's progressed a little bit further. If you have periodontitis, you did have gingivitis at one time. It just led to it, and there's a myriad of bacteria that actually does cause that. There's about 10 of them. I won't bore you with all that, but there's about 10 different bacteria that do it, and they are anaerobic bacteria, which means that once we get some oxygen to them, that's where we bubble peroxide around it. Once you get oxygen to it, it will kill the bacteria. Right. But you can't kill it because it's so far down there with oxygen. If we could open up the gums, get oxygen to it, then it does kill it. That's what we do. We open the gums up, bubble some oxygen down there, and it does. Right.
So if you're sitting at home and you're starting to think, wow, every time I brush my teeth, they're bleeding, or every time I put some floss between my teeth, they're bleeding, and you're starting to feel a little concerned, don't be. There are things that we can do here in the office to reverse that process and get you back onto a healthy mouth and a healthy way of taking care of yourself. So, we always tell everyone, if you're got any questions about things like that, give us a call here at the office. We'll get you in. We'll consult with you, talk you through exactly what we're seeing going on, and Doc will come in and walk you through his recommendations on how to get you fixed, how to get you back into a healthy lifestyle and a healthy mouth. Is there anything else you'd like to add before we go, Doc?
Maybe we have specialists that treat all this too. Being a general dentist, we see all kinds of ways to treat it. That's why I've got to be the gatekeeper. I've got to figure out which specialist do we need to send you to, if at all. Do you need to go see an oral surgeon? Do we need to see an endodontist? Is your pain coming from not the gums but from the tooth itself? So there's a lot of different ways to treat it, and we'll find it. As a last resort, we take the teeth out, but sometimes that's I would say more often than not that is what we see when we do it. Being right here in Central Kentucky, very common. We do full mouth extractions at least once or twice a week, so it's very common. Yeah.
Right. So the best thing we could say is any questions you have or any concerns, come on into the office. Doc is really good at, like you said, being a gatekeeper and going, you know what, this is something we can get here. We've got wonderful hygienists here in the office with Sam and Elaine. We can get you in with them, get you clean, get it scaled real good, and get that reversal happening. Or if need be, we can always get you to one of our specialists that we work with on a daily basis and that Doc trusts and that we trust to hand you off to. So any questions, we suggest just come on in, let us talk you through it, let's take a look, and let's get you on the road to recovery. That's going to be it for this time, and we'll see you next time at Isaac's Dentistry.